this is Jessica DelaRosa, and today I'll be going over the herniated disc. The spinous form of vertebrae, which are the bones that hold us up and then have cushions in between called discs. The discs are circular with an outer layer called the annulus with a softer inside called the nucleus. There is a disc between each vertebrae that acts as a shock absorber. If we didn't have those there, it would be bone on bone and quite uncomfortable. Now, when someone has a herniated disc, a piece of the nucleus pushes through the outer shell, also known as the annulus. The nucleus then gets into the spinal canal and presses on the nerves, which cause pain. A herniated disc can also be called bulged, slipped, or ruptured. Because we have a disc through the spine, and the spine goes from head to buttocks, a herniated disc can occur in any spot in between. It is most common to occur in the lower back and the cervical or neck area. For today's presentation, we're going to go over the lower back, and more specifically, the L5-S1 portion. See, the spine has the clivus at the very top of the spine, then the cervical, which is the neck area, the thoracic, which is the upper back, lumbar portion being the lower back, sacral in the buttocks area, and coccyx at the bottom tip. For the L5-S1, it is called the lumbar sacral joint, which ends at the lumbar portion and starts at the sacral portion. For this specific portion of the spine, it goes from the lumbar lordosis, which is where we have the curve forward, to the sacral kyphosis, which gives us the backward curve. The specific L5-S1 portion helps move weight from the spine to the pelvis and legs. Since the L5-S1 has two vertebrae involved, let's discuss the structures. The L5 includes the vertebrae bottom in the front with an arc in the back. This arc has a spinous process in the middle, and both sides include transverse processes. These are there to attach ligaments to. S1 is the sacral base that has an upper and wider end and forms a triangle. The corners of the triangle are called ali. On the back of this, there is a long bony prominence that is called the median ridge. In the spine, there is the spinal nerve. In L5, there are nerve roots that exit the spinal cord through the intervertebral foramina and small bony openings on both sides in the spinal canal. The nerve roots then branch out to reach out the nerves that go down each leg. These are the L5 dermatome and L5 myotome. The dermatome is skin that has sensation traveling to the parts of the knee, leg, and foot. The myotome is the muscle that controls the nerves in the pelvis and legs, which make our legs and feet move. In this case, her herniated spine has affected her right leg down to her knee. It is causing pain, numbness, and her leg is giving out on her. This injury occurred while she was squatting. She was overarching her back, which can put pressure on the vertebrae. This caused her disc to herniate. The force of the heavy weight and pressure in the wrong area caused it to just kind of break and the nucleus to hit the nerve. It is very important to keep your head up, eyes straight ahead, and back as flat as you can while you're performing the proper squat to avoid this altogether. For rehabilitation protocol, there will be 4 phases: acute, subacute, rehabilitation, and return to activity phase. For the first phase, acute, we want to try and control the pain and reduce the inflammation. In this phase, we want to establish positions and how the patient sits, sleeps, and stands, and ensure they do them properly to reduce pain or make them pain-free. We want them to continue to stay active and walk daily. Exercises can only be based on the individual's assessment. Part of this assessment will factor in a person's age. Some older patients will need more alternatives since they may not be able to do certain things. The goal is to find exercises they can do that will help them stretch, activate core muscles, and improve range of motion. We want them to perform exercises that minimize pain, stay active, but to also avoid daily tasks that worsen their symptoms. The first exercise I would have them do is the bird dog. They will start on their hands and knees on a yoga mat, ensuring their hands are below their shoulders and knees under their hips. raising one hand at a time, reaching forward, making it align with our torso. At the same time, the patient will kick the opposite leg backwards, still aligned with the torso. They will hold their position for 2 to 3 seconds, and then switch both arms and legs, always making sure their head, neck, and back stay in the neutral position. This will strengthen and stabilize their back and spine muscles. Doing this exercise will also ensure they are maintaining good posture to avoid further damage. The second exercise I would have her do is a plank. This core exercise helps bring the pelvis in and strengthen her spinal muscles and glutes. To do it, she'll lie on her stomach and lift onto her forearms, keeping her back in a neutral position by engaging her core and lifting her body. If she cannot perform it this way, she can stabilize on her knees rather than her feet. The third exercise I will have her do is the half cobra. This will help push the disc back to its original place. Doing this lower back extension will take the pain that travels down her leg and have it come back up to the lower back and alleviate pain. This is also called the centralization of symptoms. To do it, she'll lie on her stomach, prop herself up on her elbows, slowly, ensuring her hips stay on the ground. I will have her hold it for 10 to 15 seconds at a time and repeating it 10 times. For phase 2, being the subacute phase, we will progressively increase the patient's activity level and their walking distance. In this phase, we'll start improving their spine and lower extremity flexibility, strengthen areas of weakness, and stabilizing abdominal and pelvic exercises. We want to work on their active range of motion along with stretching their lower extremities. For strengthening in this phase, we're going to have the patient initiate core stabilization exercises that activate the transverse abdominis and multifida with hip musculature. Exercises include prone, plank, side plank, bridges, and the bird dog. Throughout this phase, this patient needs to walk daily, do stretches and stabilization exercises daily, perform lower extremity strengthening 3 times a week, and begin functional movements like squatting and bending. The next phase in this rehabilitation phase will be the rehabilitation phase, where we'll focus on aerobic conditioning, restoring spinal and lower extremity flexibility and strength, continue stabilization exercises, and doing functional lifting, bending, and reaching tasks with light resistance. For range of motion, functional, and flexibility, the patient will do spinal stretches, lower extremity stretches. Cardio will consist of walking, jogging, elliptical, or swimming. Strengthening exercises will include the bird dog, side planks, prone planks, squat and lunge progression, and using exercise machines that strengthen lower extremities. If the patient has a good motor control and endurance in her core musculature, then we can progress to functional and specific movements. Stretches will be performed daily, holding about 30 seconds and done 2 to 3 times each. Cardio should be completed 3 to 5 times a week max for about 20 to 45 minutes at a time. Strengthening will be 3 times a week, doing 2 to 3 sets for 15 to 28 reps each. The final phase is returning to activity. She'll continue her daily stretches for her spine and lower extremities and aerobic exercises. For the strength aspect, she'll transition to gym equipment and progress to wall stabilization exercises. Each person is different in how long it may take for them to return to normal activity. Things to look for are how well the patient can sit, stand, walk, twist, and bend without pain. We also want to look for improved range of motion, strength, and overall functionality compared to when they first came to us. And then here's my references. And that's all I have. Thank you.